Hi everybody, this is Dr. Kubin. I am here to do a walkthrough of your medication administration simulation so that you can know what to expect when you're doing that simulation. So for this simulation, you are going to have both a pediatric patient and an adult patient that you will be administering medications with. I will tell you that your pediatric patient, you will be giving one oral medication, or let me be more specific for you, it will be an NG tube medication. So you will be administering it through an NG tube, and you will be giving one IV piggyback. Your adult patient will have an IV medication, a drip that you will be titrating. So it will be infusing. You will have an order that will direct you on how to, that it needs to be titrated, and you will have to do a calculation on how to titrate it, and you will program the IV pump for that titration. You will be working together in pairs, your S1 and S2 mentor-mentee pairs. Y'all will be working together. The roles will go like this. Your S2 students will be more like a charge nurse preceptor type role. The S1s will be new nurse preceptee type role, okay? So here's what's going to happen. You're gonna come in, you're gonna get your assigned patient, you will pull up your patient, both of you, S1s and S2s, you'll pull your patient up on EHR Tutor using the iPads. Please make sure you know how to access that prior to coming to this lab. You will have 2 weeks to practice it, 3 actually, to practice that, so make sure you can do that. You'll pull your patient up, and then you'll be able to look at their assessments, their orders, the MAR, all the things. You will have done your medication. I can't see myself, so I hope I'm still going. You will have done your medication grid where you have looked up the meds, what the appropriate dosages should be, dose ranges, what the side effects are, how you would infuse them if they are IV medications. You will have done all of that stuff prior to coming to this, and you bring this with you so you can use it as a resource. And then you'll be ready to go. So you'll come in to the room. In the room, you will have your patients over there. And as you can see right now, we only have a pediatric patient in this room, but you will actually have your adult and pediatric patient in one room, so you don't have to go to different places to do that. And then over here where I am standing, you will have, this is going to be considered your medication room area. So all of your meds and your supplies and all that stuff will be in this area. So when you're standing here, I want you to consider yourself in the med room. And when you actually go over to where the patient is, you'll be in the patient room. So consider these two separate spaces, okay? So when I'm over here getting my meds ready, I'm not gonna be talking to my patient. I'll do that when I actually enter their room, all right? So let's start with, I'm just gonna walk you through how this is gonna work. So let's just start with me actually doing that. So when we come into the room, we're actually going to come into the medication room first, because that's what you would do if you're in real life, right? You're actually going to give your stuff. My MAR tells me it's time to give some meds, so I'm going to have my MAR, I'm going to have my scanner, I'm going to go into the med room and actually get my stuff together. So the first thing I want to do is actually look to see on my MAR what meds are due, and then I need to double check, like, what are the meds? Are these dosages correct? So I'm going to do my calculations first very quickly. I want to give you a little tip here. Like, I can see from my patient right now that I'm going to see Clark Kent that he has cefuroxime due. This is a dose that comes in a dosage range, right? When you look this up, you're going to see that it tells me 100 to 150 milligrams per kilo divided in 3 doses. Okay, this is what you're going to be doing. I don't need you to know the whole range right now. I want to know if the dose that I have ordered is safe. So what you're going to do when you're doing your calculations is you're going to take 150 multiplied times his weight to see if what's ordered exceeds that highest dose. All right? You don't need to know the whole dosage range right now. You just want to know is if what's ordered exceeds what the highest dose is. Okay? That will save you some time as you're doing this. So I would do my calculations for the purposes of this demonstration. You don't need to sit here and watch me do my calculations, but what I'm going to be doing is going through my calculations while my S2 mentor is also doing these calculations, and then we're going to confer together to make sure that we've got the same calculations, to make sure that we're giving the correct dosage of these medications. Now, I see on this patient, I need my mentor because I have a question about my meds. And I will tell you that all of you are going to have, scooch in, all of you are going to have embedded errors in your pediatric patient. There's going to be something that you're looking for that's not quite right. So I have a question because I see that this medicine right here, this med right here, I think has a different name, and I think it's the same as this, which my patient is allergic to. So does that mean that I shouldn't give this even though it's ordered? What should I do?
You would want to hold it and call the physician and let them know.
Okay.
See if there is another medication, or if they have the allergy incorrect, what's the issue.
Okay, so I'm not going to give that one right now as I'm preparing my other meds. And then afterwards, after we give these meds, then I'll call the physician and ask about that one.
Sounds good.
Okay, thank you. All right, so I've done all my calculations. I've determined that I'm not going to give this one med at this time. I'll call the physician after we do our other meds and determine whether or not what I should do about this one med. But otherwise, I'm going to, first of all, I'm going to do my hand hygiene. And then I'm going to get these other medications ready. So the first med I have is this IV med, and I'm going to double check this is the right patient. Clark Kent. This is the medication, 750 milligrams, IV piggyback, 750 milligrams and 100 mils. Okay, that's correct. And it's the right time, 0800. Okay. And then this is the one that I'm not giving, so I'm gonna just put this away over there. I wanna put it aside. And then I've got Phenytoin, 120 milligrams. It comes 125 and 5, so I need to give .8 milligrams, is that correct? 4.8 mils, I mean. And this is 4.8 mils, is that correct?
Yes, that matches my calculations as well.
Thank you. So I'm gonna give that one, and that's all that I'm giving right now are these two meds. Now this one is gonna be in the NG tube, so I'm gonna need fluid to flush with.
How much fluid would you want to flush with?
He is 5 years old, so I probably don't want to flush with a whole bunch, but I could go between 5 and 10 mils.
Mm-hmm.
I'm just gonna do 5. And this is sterile water I'm using. Have a little air in that.
Yep.
Okay.
That's good.
And then I also want just to take a blank syringe with me, an empty syringe with me to verify, to pull back any gastric contents. That, I'm gonna go ahead and, while I'm in here, I'm gonna go ahead and open up this and prime my tubing.
Okay, so you're gonna prime the secondary tubing?
Yes.
Okay.
Oops, just dropped that. So I need to make sure that this is clamped. I have to go over here, sorry. Sorry, I'm off camera while I'm priming. Okay. Okay. So now I have all these ready. ready to go. Notice please that as I go to the patient's room, I'm only taking my MAR and my scanner and my medications with me, not my paperwork, because that's not what I'm checking things against. So when I come into my patient's room, hello, hi everyone. Hi Clark, how are you? Hi, are you Clark's mom? I am Laura and I'm gonna be Clark's nurse today, and this is my preceptor, Nikki.
Hello.
How are y'all? Clark, how you doing? Clark, can I sit you up just a little bit? Are you okay with that? Nikki, would you do that for me?
Yes.
Because I can't reach way over there.
Sit you up a little bit. That look good?
Clark, is that a Dallas Cowboy hat you've got on? No, that doesn't look like that. Is it?
Yeah, that looks like it.
Are you a Cowboys fan? All right, I've got a little bit of medicine for you. One is going to go in your tube in your nose, and one's going to go right here in your IV. All right. So before we do that, I just want to. I'm going to do a little check to make sure that this is in the right place where it's supposed to be, and I'm going to assess your little IV right here. Does that hurt when I touch it? Good. Okay. Clark, can you tell me what your name is, your first and your last name? Clark Kent. Very good. Clark, do you know when your birthday is? You're right, it is in January. Mom, can you tell me his full birth date? Right, 1/5/21. Very good. And does he have any allergies? Ativan and Keppra. Very good. Nice. Okay. Clark, I'm just gonna scan your little. There it goes. Yes, that matches. There you are. Okay, that does match. So you're the right person. Again, I'm checking my meds one more time, just to make sure I brought the right things in here.
And what medications are we gonna give?
All right, so we're giving cefuroxime, 750 milligrams, and 100 mils, and it's 8 a.m.
Okay.
That's when it's due. This is the one we're not giving. And then phenytoin, 120 milligrams in the 4.8 mils. Those are two that were given. And then this is my flush. This is for me to check placement.
Okay.
Okay, so I scanned his armband. I'm gonna scan these meds too. So it comes up like this. Do I need to show this on the screen? So this is what it shows. This is what it looks like. Yeah, you can see that. That's what it looks like after you scan the meds. So you can see where it already tells you given. This is your right documentation. But if I need to put anything else in here, like if I wanted to put the rate that I'm infusing it at, or the location, or any other, like maybe like assessment data, like if I were giving DIG and I wanted to put what the heart rate is or anything like that, I could put that there. Okay? If I needed any other signatures or anything like that. Otherwise, I'm just going to hit this little blue button where it says update chart. So I'm going to do that right now. And then it will show, please wait. There. Now it will show that it was actually given right here. Okay. So I'm going to do that for all of the meds that I'm giving. All right, and now I'm ready to actually give. So I'm gonna start, I forgot my alcohol. First I'm gonna scrub the hub.
How long are you scrubbing it for?
20 to 30 seconds. 30 is ideal. And now I'm talking to you and I lost my count. So we'll just go a little extra. Now I have to also let it dry. So while it's drying, I'm gonna go ahead and hook this up. Mom, do you, have they told you why Clark is getting this medicine? This is an antibiotic, it's called cefuroxime. That's correct. It's because he had surgery. And so it's just to prevent him from getting an infection. Some of the, have they talked to you about the side effects? Do you remember what those might be? Yeah, that's the biggest one, is the upset stomach and diarrhea. I'm sure he likes to talk about that because you're 5, right? You're about all things poop, right? Ew, I know, gross, right? Okay, so I want to make sure that I lower my primary because I want my secondary to be higher. It's all about gravity. And I'm gonna go ahead and start my secondary. Now, one of the things when you're doing the pediatric medications is most of the time they are not over here in the library, so you have to use the basic secondary. And so I'm gonna set my rate, and this, because this is an antibiotic, it's 100 mils. Most antibiotics go over 30 minutes, and so in fact, this one will go over 30 minutes, and so I want it to run at 200 mils per hour, and the volume to be infused again is 100. I'm going to start that and make sure that it's unclamped, which it is, and the way that I can double check that it's going is to look for that I've got drops. So I have drops. Okay, so now I'm ready to give my NG tube. So I've got my gloves here. So the first thing I'm going to do is put my gloves on. And I want to double check my placement. So I read in the chart that his NG tube A was confirmed by x-ray. So I know that we can use it. Mom, has he had any problems with nausea or vomiting or anything with this NG tube, or when they've given other meds or anything through the NG tube? Okay, great, thank you. Okay, and then I read in the chart that it was at 35 centimeters at the nares, which is where it is right now. So that's my first check, and then the next thing I want to do is to confirm that I'm going to pull back to see if I get any gastric contents. Y'all, when you're doing this, in your simulation, you're not going to use the NG tube that's actually in the mannequin. You will have one that's in a bucket like this that you're going to actually use for the simulation. So I'm going to, first thing I'm going to do is clamp it off just because I don't want stuff to come out. So I'm going to put this empty one in and pull back to see if I get any contents. If I do, that's a good sign. And the other thing I could do is check the pH. And the pH that I would be looking for is anything 5 or below. We don't have any pH strips at this moment, so I can't check that, but I am just looking for actual contents. So the next thing I'm gonna do then is to actually give my med. And I'm just gonna use slow and steady pressure on that. Clark, are you doing okay? All right, let me know if there's any issues. Again, I'm gonna clamp this off with my fingers, just pinching off. And then I'm gonna flush with some water. Mom, that was the phenytoin or the Dilantin that I just gave him, which he takes us at home, right? No problems with that? Okay, good. You doing okay, Clark? Okay. Clamp that off, and I'm just gonna then cap off that. All right. Clark, are you okay? Do you need anything else from me right now? Do you have any questions? Mom, do you have any questions for me? Okay, Clark, do you want to lay back down or do you want to keep sitting up? You okay like this? All right. You have your call light right here. If you need anything, you just push that button that has that little nurse's face on it, okay? All right. You'll let me know if you need anything, and I'll be back to check on you in a little bit, okay? All right, I'll see you after a little bit.